if my back or my hip hurts, I can still have a conversation and eat dinner with my family. When I have one of these headaches, life shuts down, life stops. So they're like, if we're going to start somewhere, let's start there.
I have an MS patient with migraines who came in a year and a half ago, and she has not had an MS episode nor migraine for that period of time since my procedure. I've been practicing 30 years, and probably the first 10, I was helping people with sinus problems who also had headaches, And those people would come back and say that their headaches were gone after I did my septoplasty, turbinectomy, some sinus surgery.
Let's unpack a little bit of the headache situation that you see a lot. So there's multiple types of headaches, right? So we have migraines that can come from multiple different triggers. Can you explain a little bit of the different mechanisms behind migraines and what issues can cause some of them?
Hey everyone, Derrick Hines here. Welcome to the podcast where I'll share with you the patterns, insights, research, and technologies that we use in my own pain and performance practice to help people improve their health, speed their healing, and increase their longevity. Thanks for listening. I hope you enjoy it.
Love it. Dr. Kevin Smith, welcome to the Pain and Performance Podcast.
All right, thank you very much for having me. I'm looking forward to this.
Yeah, thanks for jumping on. I'm excited about this. I feel like when we talk about certainly like the whole complex of migraines and headaches and breathing issues, that opens this whole can of worms that I want to try and unpack with you of how many areas of our life this affects and how many people are dealing with some of these things. So thanks for jumping on. Thanks for sharing your expertise with us.
Yeah, I'm very happy for this because this is right in my wheelhouse. Pain and performance, I deal with it every day.
So when we're looking at, let's unpack a little bit of the headache situation that you see a lot. So there's multiple types of headaches, right? So we have migraines that can come from multiple different triggers. Can you explain a little bit of the different mechanisms behind migraines and what issues can cause some of them?
I will tell you from my standpoint, and briefly, if I could just take you through how I determined that I was eliminating migraines with the nasal surgery I developed. I've been practicing 30 years, and probably the first 10, I was helping people with sinus problems who also had headaches, And those people would come back and say that their headaches were gone after I did my septoplasty, turbinectomy, some sinus surgery. Probably the second phase of my practice, I looked at it carefully, and I thought that these headaches were what I call migraine imposters. Patients came in, they said they had migraines, they'd seen neurologists, they had all the triggers, food, chocolate, wine, weather change, that kind of thing. And I was doing my surgery and they were getting better. About almost 90% of those people got better. And I looked at the data, wrote a little paper on it that showed that I was helping people with what I call at that time suspected migraines, because in medical school I was taught that migraines are in the brain. And, that's what I was going with. But then I was on the doctor's show, and I happened to tell people that they could have access to my expertise by sending me scans of their sinuses, and I would look at them to see if they're a candidate for my procedure. And lo and behold, I got hundreds of scans. They all had the abnormalities that I fixed, and they had all had a long history of migraines and had been evaluated by some top neurologists across the country. And that's when I knew, wow, what I'm doing is truly eliminating migraines of all type. It's not just a sinus migraine or an ENT migraine that people might think. I've eliminated migraines of all type. And so I've just taken the ball and run with that because, as you well know, what you do, migraines are very devastating. They can affect people's mentality. They're oftentimes depressed. They have PTSD from it. They're isolated at times because they've had them for years and can't go to functions and integrate with their families like they normally would. And then they get, they're disabled. They can't work. And then some of them, unfortunately, have thoughts of suicide too. So it's
yeah, that's always the question whenever I'm
devastating.
talking with a patient. I'm like, if we got multiple issues going on, and I'm like, look, it's better if we focus on improving your health in one area than me just like scattering treatment out. Which one of these is important? And they're like, look, if my back or my hip hurts, I can still have a conversation and eat dinner with my family. When I have one of these headaches, life shuts down, life stops. So they're
Exactly.
like, if we're going to start somewhere, let's start there. When
Exactly.
you're looking at
Yeah.
these scans, we're gonna dive into the good stuff right away. When
Oh,
you're
good.
looking at these scans, like what are the things that you see that I can change these and they relate to this person's headaches?
Very, very good question. First of all, it's important that I get the scan, not the report, because oftentimes reports that radiologists give you will not have the things that I know cause the problem. So it's highly specialized. The things that I look for, and most commonly, would be a deviated septum, enlarged turbinates, and some sinus disease. And so those things can all occur together. They might be isolated. And after I look at the scan, I have a very detailed evaluation form that I fill out. And from that and from the questionnaire that we have, I formulate the procedure that needs to be done. So it's not a cookie cutter, it's customized based on what's shown on the scan. But the procedure itself, although it is a septoplasty and turbinate reduction procedure and balloon sinuplasty and sinus surgery, I have developed it to such a degree that it's highly specialized. It's a special technique that has to be done to ensure that you get rid of the migraine and the chronic headache and not just helping somebody breathe better or helping
Yeah.
somebody to have fewer sinus infections. Now, of course, the benefits of my procedure also help with that, but the primary goal is to get rid of these migraines. And my Smith sinus migraine technique is a technique I've developed and continue to develop to help get rid of these severe migraines at a 90% success rate.
Can we unpack these a little bit? So you have I think everybody understands what the nasal septum is, or everybody has at least
Yeah,
heard of it. They probably don't
yeah,
understand what it is.
right,
Um,
right.
can can we unpack these structures a little bit for the audience so they kind of understand
Yes.
what their role is in the sinus
Okay. That's a
system?
very, yeah. Um, the nose, of course, is very sensitive. I tell people that if you've ever had one of those original COVID tests, they hurt until the COVID swab is removed. And in the very simplest form to explain to people, these abnormalities in the nose, these specific abnormalities that cause these headaches and migraines, act like a permanent COVID swab in your nose. They're very sensitive structures in the nose. So you have the septum, it divides the right and left nasal cavity. In the front of the nose, it's very soft and mobile, made out of cartilage. But in the back, it's made out of very, very thin bone. Um, Adjacent to these, you have these very dynamic structures called turbinates. And these turbinates are very, very sensitive. They like to hang in the nose. They're like your air conditioned coils of your nose. They do not like to be touched by anything. And they filter the air, they humidify the air that you breathe in. They also warm the air if it's very cold outside. They'll cool the air if it's very hot outside so that the air that gets to the lungs is more or less body temperature. Okay. So you have that, and then lateral to those in your face, you have these structures, these sinus cavities. These are air-filled cavities that make the head lighter, for one. They produce mucus, two. They help with resonance of your voice. And it's important that those drainage holes for those sinus cavities are open, they drain well, they aren't obstructed where you get sinus infections or you get pressure in your face and head. And so those are the things I look at. And you can imagine the nose gets injured often. The first trauma is coming through the birth canal. You won't remember that if I asked you, have you ever injured your nose? But if somebody has a history, say, of having a long labor, even if they were delivered by C-section, you can imagine a C-section might have been done because the mother was pushing for hours, couldn't get you through, and your face has been pressed up against her sacrum for hours. And so that could be the very first trauma. But oftentimes, you have the bicycle accidents, the sports injuries, the car accidents, motorcycle, and so on. And those things can injure the nose and cause abnormalities, and those abnormalities then can give you a myriad of symptoms in the ENT realm, including headaches and migraines.
One of the things that I did want to at least kind of touch on with you, because we've had a lot of athletes that have come to us after head trauma, is the relation of all these structures to the blood flow to the brain. Is that something that you have looked at in any degree? Like, is there blood flow scans before and after some of these procedures? Is there any studies
No,
on that? I was trying to pull that
I
out, but
don't. Yeah, I don't know if there's any studies, particularly with blood flow. I've not looked at that. But what I do look at and what I do understand is that airflow and breathing is absolutely necessary for an athlete to achieve their peak optimal athletic performance. I was a college athlete. I played high school ball and college ball. Never once during my physical exam has anybody ever said, one, just ask me, how do I breathe? Two, has never said, look, as part of the physical exam, we're going to get a sinus CT scan to make sure that your anatomy is normal. Because when you look at athletes, athletes have played contact sports most of their lives. So their nose is going to get injured more so than the general population. And that being said, if you have an athlete with an impaired ability to breathe, they're not going to sleep well at night. They're going to have less energy during the daytime. When they're performing, the ability to breathe through your nose is the most efficient way to breathe. So you want to have both oral breathing through the mouth and nasal breathing to be optimal. And nobody is doing that. And that's why I'm looking at the Smith Sports Performance protocol as it relates to screening athletes with CT scan of the sinuses, having me review that scan, and then fix those athletes that have the nasal abnormalities so that they can achieve better performance. I mean, you can apply that to every sport. Think about soccer or track and field or basketball, football. Think about the Olympians that are preparing now, some of whom have deviated septums, large turbinates, aren't sleeping well, but they are the peak and epitome of athletes that we have in the world. However, they have not reached their full potential until they get their noses fixed by me.
I'm gonna let's go down this because I do think there's been some great books in the most, I don't know, last couple of years on like how important breathing is. I love Breathe, James Nestor's book, and a lot of people have started paying attention to the fact that we need to be breathing through our nose better. And look, I mean, you're in Texas, I'm in South Louisiana. This time of year, everybody's like, breathe through your nose. I can't breathe, period.
Right.
I'm dealing with
Yeah.
sinus issues. I'm dealing with all this stuff. But I
Allergies.
do think yeah, exactly. I do think there's this renewed interest in how important it is to be able to breathe properly and how many areas of our life, our sleep, our recovery, that affects. If somebody's not breathing well, you take your athlete that you're just talking about, and they're having some issues with nasal breathing, during the day, nasal breathing at night. What's the chain reaction in that? Like, what starts to happen that's stopping them from recovering? What's going on in the body? I know that branches out. I'm putting a lot on that, but
No, that's okay. No, let's just start with the basics. Um, a nose that's impaired or partially obstructed or 100% obstructed will cause a myriad of symptoms: runny nose, postnasal drainage, frequent sinus infections, headache, migraine, postnasal drainage, throat pain, snoring, sleep apnea, which is impaired ability to sleep, insomnia, waking up at night, feeling tired during the daytime, which then affects your performance, whether at work, if you're going to work or going to school, or you're a finely tuned athlete. Performance in all areas is impaired. And then over time, if that goes on for years, now you have somebody that's sleep deprived. They're chronically tired. They can't focus. They can't exercise. It's a chore to get up every day and do the everyday things that people who breathe well do. So it really impacts people. And then you have these other little nagging symptoms: dizziness, intermittent hearing loss, muffled hearing. My ears feel like water is in them. These are things that nag you and you just don't feel normal. Um, so if you're trying to perform as an athlete and you're dizzy and you have ringing in the ears, you can't hear good, intermittently, you can't breathe well, you didn't sleep the night before or the night before that or the year before that, it's just a downward spiral where you're struggling and working very hard with strength and conditioning, but you're never going to achieve your maximum performance. So what I do is, by correcting these abnormalities, I allow an athlete to truly reach their peak performance, as good as they are. I mean, I can use, for example, let's look at Draymond Green. When you see him running down the court, his mouth is always open. That tells me, as an ENT, just looking at him, his nose is blocked. Let's take Patrick Mahomes, a $500 million quarterback for the Kansas City Chiefs. He gets teased about his voice and how he sounds. Well, the reason it sounds that way is because his nose is blocked. So as
You can
good as
almost see
he
it with
is,
him, like in his face, you can almost see
yes,
it.
yes, you can hear it. The resonance isn't there. It's a hyponasal voice. His nose doesn't get involved in the ability to talk, and people tease him about his voice. But here you have a $500 million quarterback who is very good, but he's not as good as he could be. Yeah.
Yeah. Or is
Does that
it,
answer
you
the
know, does it
question?
become a longevity? Yes. No, I mean, that's right. Does it become a longevity issue in some of
Yep.
these people? You know,
Yep.
because you're focused and you're doing all that while you're young, and your body can bat off some of these issues. But as
Exactly.
we go through, you know, time and aging and all the things that come along with
Mm-hmm.
that, it gets tougher. That one of the things that really woke me up to this. So we do, like, the way I explain this to patients in the office is like, you know, if you have a spinal issue and your joints aren't moving real well in your spine because the muscles are pulling asymmetrically on it, and you've slept in a bad position, we can fix that joint using hands-on stuff. We don't have to do surgery on that.
Mm-hmm.
If somebody's had some
Right.
minor issues from a sinus standpoint, they've had head trauma. Um, we do a light procedure called an endonasal balloon that
Mm-hmm.
is more like, you know, an adjustment. It's very light balloon
Yep.
pressure,
Yep.
helps to kind of make sure things are moving well. And I've had a number of patients since we were doing that had dizziness improve, that had, you know, like minor acute headaches improve, where like, hey, these started
Mm-hmm.
over the last 2-3 months.
Mm-hmm.
And then ringing in the ears, you mentioned, and that's probably been one of the bigger ones where people will do those endonasal balloon procedures,
Mm-hmm.
and they'll come back and they're like, look, you know, my tinnitus is 75% better, and I've been dealing with this
There
for a
you
while.
go.
So we started unpacking what, when we're dealing with issues and inflammation and problems here,
Mm-hmm.
how many areas around all of the nervous system in the head and face is it affecting? Now, you know,
Right.
you take those are these, like, you know, more like minor structural cases. And
Yep.
then you're up in the, hey, we've got major structural issues. We actually need to go in
Mm-hmm.
and do a procedural correction for some of that stuff.
Right.
But
Right.
how do a lot of those, so when we talk about like something like, you know, the turbinates starting to get inflamed and starting to kind of
Mm-hmm.
you know, hypertrophy and become dysfunctional,
Yes.
what's the process for that? Is that chronic inflammation in that from a trauma, or is there lifestyle factors that we see that are, contribute to that?
It's all of the above. As people age, first of all, you know, like in men, our noses and ears are going to get bigger. The turbinates are very dynamic structures in the nose. So things that affect the turbinates are inflammation, things that you ingest that are inflammatory, or salty, let's say salty foods that would retain water and cause the turbinates to swell. Environmental conditions, exposure to smoke, dust, pollen, causes the turbinates to swell. COVID now. Let's think about COVID. It's a highly inflammatory condition, especially the first variants of it, where people would just get very congested. Their sinuses would fill up with this mucosal thickening, and they'd get headaches that they never had before. Even some of my patients who were headache free after my procedure for years would get these headaches and migraines, and they would go away in about 6 months, or I would have to do an additional procedure on some sinuses to help them. So environmental plays a big role, but what you eat, which may be inflammatory, uh, pregnancy, retaining pregnancy, or the menstrual cycle, that water retention can cause the turbinates to really swell, and that's why you get patients and women who have these hormonal migraines. They come on when they have their period. Um, So yeah, all of those things can, and just as you get older and fatigued and you're exposed to all these things, your turbinates can from one day be pretty normal, and then the next day people will ask me, they're like, well, why did it just start last year? And
Yeah.
that's just where along the line those turbinates got more and more swollen until it became to a critical point where they started having problems. And all the problems your adjustment that you talked about, what you're doing with the nose is you're aligning some of those minor problems. Maybe a mild deviated septum that's able to be mobilized now, it's more straight. And so, what you're doing with respect to the muffled hearing and the ringing in the ear and dizziness is you're helping the eustachian tube, which opens up in the back of the nose, you're helping it to function properly because now the airflow has been improved. There's not mucus plugging the eustachian tube intermittently and causing those symptoms or chronically causing those symptoms. And so, yes, airflow in the nose is highly important for all of those symptoms to improve that we talked about. And that's where my expertise comes in. And I have a scanner in my office, this Carestream scanner that's very quick and fast. It takes a CT scan in about a minute, and there's very low radiation. So in my office, pretty much everybody's going to get a scan because I understand how the nose can lead to all those symptoms, ringing in the ear, which if you don't understand it, you're thinking, why would the nose cause that? But as an expert in the field, yeah, it's very important to first look at the root. I'm a big root cause guy. Um, so my deal is to always look for the root cause of a problem and not look at something that's pretty much esoteric, and because it's pretty much going to fall into the nasal category and a nasal abnormality leading to the dizziness, ringing in the ears, eustachian tube dysfunction, muffled hearing, snoring, sleep apnea.
So if we're going in and fixing those things, this is where I'm always interested in this part. What is that? Like, what's actually being done to the turbinates?
The turbinates are being reduced to their normal size. Overall, what I'm doing with my procedure is normalizing the nose. It's addressing noses that are abnormal and making them normal, whether it's straightening the septum, reducing the size of the turbinates, which can be done by a number of ways. You can burn the turbinates with a little hot needle to shrink down the mucosa of it. However, some turbinates are primarily bone. They're bony, covered with a very thin amount of mucosa. So in a lot of cases, what I do is I'll trim the turbinates, excise a portion of the turbinates. They're very important. So you can't excise the whole thing, but you want to just excise it to the point where it's normal. They're breathing better. I can understand the healing and how much, when you use a hot needle, then the healing is pretty unpredictable in a sense, because you have to treat each turbinate exactly the same as far as how long you hold the hot needle to reduce it. But I find that works best in my hands is to actually trim the turbinates down so that I know that a certain portion of it, usually about a third of the turbinate, I'll trim, a quarter of it is gone and it will not return. And so people are permanently going to be able to breathe better.
Yeah. What's your thoughts on doing like rinses or, like treatment after the nasal procedures are done?
Well, for my post-operative care, it's very important to do saline rinses because the nose is going to heal faster in a moist environment. If you can imagine, when you get a cut externally, you're going to have a scab form. Well, the same is true on the inside of the nose. It'll form these crusts and scabs, and as it's healing, and it usually takes about 6 weeks for all of that to be complete. So I'll see patients back 1 week after surgery, then 3 weeks after surgery, and then 6 weeks after surgery, just to make sure I can debride the nose, clean it out, pick off the crust, make sure they're doing their irrigations, and make sure there's no scar tissue in the nose too. I know from doing my procedure that scar tissue can also cause chronic headaches. So when you're in there, again, it's very important that you treat those tissues with tender love and care, and you're just not going in there being like Rambo when you're doing surgery. And so, I'm a facial plastic surgeon as well. And so facial plastic surgery requires me to be very analytical, very detailed, very precise, hiding scars, doing the procedure, being artistic with it. And so it carries over into the work that I do inside the nose with my Smith sinus migraine technique, because I, again, have to be very cautious and tedious and precise and careful so that I get in, do the procedure, and get out without causing any complications.
Yeah, I wanted to ask you about kind of like emerging technology and research in this field. We had a patient who had a procedure, was not getting quite the results, and I don't think that the follow-up care was probably what you would like to see.
I see.
And so we started doing a very low level intensity on a high intensity infrared laser and doing it endonasally. And within probably like 3 sessions, he started having discharge, lots of like what looked like, some pussy discharge, some scar tissue, some scabbing and stuff started coming out. Now this is 3 months post surgery, 4 months post surgery.
Oh, wow.
And then within a month of starting those procedures, he's like, now all the like I'm actually reaping the rewards of this. So kind of what you're saying, like the aftercare was the procedure itself was done fantastically, but the aftercare was not allowing him to reap the rewards of that. So that's really important. But I did want to.
It's very important.
So we've used something like that to speed healing and increase the recovery time in a pretty dramatic way in a lot of cases. Is there some stuff coming out in the breathing world, in the sinus world, in terms of emerging technology? I've had patients ask me about everything from PRP to stem cells to, go ahead.
Yeah, well, there are a lot of things that people are looking into. And of course, anytime, I think the most important thing is the reduction of inflammation. I will often give my patients a round of a little low dose steroid afterward so that they can get through the healing phase without a lot of inflammation and swelling, because that's where you might get increased scar tissue and prolonged healing. Of course, it's very important that people don't smoke. So it's about, first of all, addressing the basics. We've got to do the procedure. You've got to take care of it because it's a team effort. And in taking care of it, you have to eat right. You have to do all the instructions as far as your cleaning, take your medications, don't smoke, those kind of things first. But just like you talked about with the infrared treatment, that's a very good treatment that helps reduce inflammation and helps heal. And as that patient you mentioned started to reduce the inflammation and heal better, then those crust and things were released from the inside of the nose, and now they start to feel better. Lasers have always been looked into as far as how their role can play, as far as not only executing a procedure, but also aiding with healing as well. The different light treatments, like you mentioned, I think those are some of the more emerging technologies. One thing that's really big that was a godsend for ENTs is balloon sinuplasty, to help dilate the normal drainage ports and openings from the sinuses by using these small balloons that are like 6 by 16 millimeters in size. But the thing that the general public doesn't know is that there are about 5 to 6 different balloon companies out there. And I, in my personal opinion, think that there's some that have they're much better at what they do than others. And there's some that allow surgeons to be much faster in what they do, but not necessarily better. And this first hit me when I would have a few patients to say, I had balloon sinuplasty done twice and it really didn't do anything. And I was so bad, like, what? It didn't do anything. My patients, I do the balloon on, 95% of those folks are just happy and they do quite well. And then it hit me, there are different balloon systems out there, different doctors use different techniques. And so not all balloon sinuplasty is the same. But that was a great advancement that was brought into our field by a cardiologist, actually, because they do angioplasty of the heart. And a cardiologist needed sinus surgery. and was like, wait a minute, you want to go open up these big holes in my sinuses? There's got to be a better way. Sinuses have to drain from a certain port or opening. And he worked together with this ENT, and they came up with this balloon sinuplasty. And man, the rest is history. That's probably the biggest advance. The other is having the CT scanners, these mobile CT scanners, these smaller CT scanners in our office is very, very good for us because it allowed us to be very efficient and on the spot. I used to have to send people out to get imaging, wait for it to come back. They come back with the scan, we review it together. I have a report, and that would take a week or two, you know? So this allows me to be more efficient.
That I didn't know that was how the balloon sinuplasty got started. I love it. The necessity
Yeah,
breeds invention, right? Like,
that's right. It
let
does.
me think through this. When migraines have this big in research, they have this big genetic component. What do you think the genetics are being passed down? Do you think that's structural? That the structure of their sinus cavities, um, obviously our bone structure certainly has a very big genetic component.
Mhm.
I know there's a lot of factors in there, but if you're improving migraine symptoms this much, it's
Mhm.
like something um, from the genetic component is being changed.
Yeah. Um, to acquire a nasal abnormality can be both from an injury, which is the majority of it, but certainly an hereditary component also you have to factor in because people's noses can develop on the outside to have a certain look. And certainly you have to say that it has to apply for the inside of the nose too. So, especially noses with very, very large septums, uh, they would then have the ability to sort of grow off more so than, say, a smaller septum, in my mind. So that
Yeah.
absolutely you can acquire this. There are family members who I've seen who a majority of the family members have migraines, the grandmother, the grandfather, the father, and the mother, and the kids and the cousins. And I've treated a lot of these family members and gotten them migraine free because they have the specific abnormalities that I know cause the problem. Um, yeah, so it is structural. And when you think about it, migraines are thought to come from the brain, but the structures I'm talking about in the abnormalities in the nose are high in the nose. They're near the brain though. The nose is right below
Yeah.
the brain, and it's very sensitive. So it refers pain to the forehead, the temples, top of the head, cheeks and eyes, and behind the eyes, and those kind of things.
Well, that's why I was asking about the blood flow component because we've worked with a number of doctors who are looking at post-concussion syndrome, and one of the things they see is that the function of the sphenoid bone can highly affect the blood flow into the brain and all of the structures, kind of that would supply. So if we're having dysfunction and inflammation here, and that starts to cause any carryover into these structures that are closer to the blood flow, it makes a lot of sense that head trauma is going to affect that. And if we can improve it by doing some of these procedures, then we can reduce the long-term effects of blood flow just issues in the brain, from traumatic events or from something like this, from a hereditary problem.
And, it's good that you brought up this traumatic brain injuries because let's look at somebody who's gone through something and had a traumatic brain injury. Usually they're going to be maybe some internal injuries acutely, some long bone fractures, hip fractures, that kind of thing that need to be addressed immediately. But oftentimes these people, once all those things have healed, months later, are left with these chronic headaches and migraines. And generally, doctors will pat them on the back and say, that's right, you had that traumatic brain injury, and that could certainly explain why you have these headaches. You're going to have to live with that. It's part of your syndrome, if you will. I don't believe that, and we shouldn't be telling people that. Um, Whatever caused the traumatic brain injury, the nose is attached to the head. So if there's a traumatic brain injury, the nose is right there in the front. And more than likely, it hit a dashboard. It got traumatized as well. It's just that it took a back seat to all the other things. But once those things are healed, it's imperative to tell those people, let's get a sinus CT scan. Let's send that scan to Dr. Smith. Let's have him look at it to make sure that your nose looks normal, because he knows that the nose can play a role in these chronic headaches and migraines. So you have to give all of those people, and even people with migraines that are associated with other neurological conditions. Migraines are associated with about at least 75 neurological conditions: chronic fatigue, irritable bowel, Parkinson's, MS, Alzheimer's, ALS. So the migraine component of those should also be worked up, because I can eliminate that portion of it. And then we can look and see, well, how does that affect their neurological disorder that they have? We'll look at that. I have an MS patient with migraines who came in a year and a half ago, and she has not had an MS episode nor migraine for that period of time since my procedure. So I'm looking at that. I just read that Michael J. Fox, and I was always suspicious of this. Michael J. Fox has had 2 septoplasties to fix a deviated septum. And when I read that, I went, just what I thought. Some of his problem is likely related to a residual deviation or something going on, or scar tissue or something. There's something in his nose. So I'm trying to get to him to see if I might be able to help at least halt the progression of his disease, because it's just a shame that he has to live the way he is, or not live in that sense.
I want to, so in people who are suspecting that this might be part of their issue, like, I think somebody listening to this would be like, well, how do I know if I am the person who's having migraine issues? Is most of that based on the CT? That, like, if they've had migraines and the CT comes back clear, you're like, look, I think look up other avenues. This might not be the cause for you.
That is certainly a possibility. However, that's very rare in my practice. I can only think of a handful of people where I told them, I just don't see what's going on here. The majority, let's say 98% of folks, if you get a CT scan of this, have something. So in other words, it's not a guess for me. It's not a, well, your scan looks fine, let's try this and da-da-da-da-da.
Right.
No, I don't go down that route. When you get a scan of your sinuses and you ship it to my office, I look at it personally. I will give you a call. I will let you know what I found and what needs to be done to eliminate your migraines. And again, the success rate is 90% of people I do this on don't have another migraine. So the odds are very good. I'm frustrated that the 10% don't. What's going on with that? And that's what I'm looking at now. What am I missing, or what other component is? I've just started to look at PTSD as a part of maybe explaining, because the brain has a way of, with the neuroplasticity, it has a way of maybe memorizing the fact that you had pain, and maybe it's still playing a role and you can't get over the hump, even though I've done my procedure and you should be fine. Maybe it's PTSD related. Maybe there's something else going on. So I started to refer some of those people out to therapy to help deal with PTSD, because I really care for those people. Those are the ones that, the ones that do well, I'm happy for. The ones that don't do well hurt. And I'm just frustrated and have to figure out, well, why is it that they aren't doing well? So I have to look at every aspect of their lives. What else could be going on? What else might be there? Is it PTSD related? Is there something else going on? So that's part of some of the work that I'm continuing to do.
Is there a certain type of CT? Like, if I'm sending a patient, is other than, hey, I need a CT of the sinuses, yes. Is there anything more that we need to be asking for, that we need to be advocating for?
It might be listed as a CT maxillofacial CT, or CT scan of the sinuses. More specifically, you want all 3 views: the axial, the coronal, and the sagittal views on that. It's thin cuts as you can get. Mine is pretty continuous. I can scroll through, and there are no gaps, a 2 millimeter cut or a 1.5 or what have you. Or if they're nearby, just come to the office and we can scan you. We have a scanner in the office. But the best thing to do is, I tell people, go to your doctor or call us, and we can actually send you a paper that has the code on it to get that specific, so that your primary care doctor can order this CT scan with this code. And I tell people too, tell your doctor that you have headache and facial pain, which is what it is. If you mention migraine, they're going to want to kick back and get a brain scan. And interestingly enough, brain scans in migraine patients, only 5% of scans are positive for, say, an abscess, a tumor, or inflammation that might explain the headache. 95% of all scans done on migraine patients, brain scans, 95% are normal. And the opposite is true for me. About 95 to 100% of sinus scans are positive based on the things that I know that cause the migraine and the chronic headache. Yeah, so it's pretty fascinating, those numbers.
Yeah, that's very fascinating. If we're looking for something that doesn't give us any action,
Hmm.
yeah, we're not improving things very much
Right.
from the patient level.
Yes.
I wanted to jump on sleep apnea for a minute because I've had many patients. Certainly, we've had a lot of listeners reach out about sleep apnea in terms of studying um, their own sleep scores and having issues with some of that stuff. And a lot of them are using devices, using some version of a CPAP or something like that, and asking, look, I don't know how much this is better, but they're telling me I'm getting better oxygen scores and I'm,
Uh-huh.
improving, but I don't feel a whole lot better.
Hmm.
What is your experience with this relating to sleep apnea? Can we change that? I know sleep apnea can be multifactorial, but um, what do you see around sleep apnea?
Oh, that's a very good question, Doc. You're hitting on all the high points today with these questions. Nasal airway obstruction is a big component and contributor to obstructive sleep apnea. And in my practice, again, my philosophy is let's look at the root cause of your
Yeah,
problem. And the root cause is the nose could be a problem because that's an airway, and the throat can be a problem. So let's look at that critically, examine it critically, and let's see if there are abnormalities there. Deviated septum, large turbinates. Is your uvula long and thick? Are your tonsils huge? Is your soft palate and uvula and tonsils long and floppy and causing a partial obstruction? Um, so in my practice, because I do some of my procedures in the office, there was a time when I would do a UP3, which is a uvulopalatal pharyngoplasty in somebody with sleep apnea, where you would take out the tonsils, trim the soft palate, and trim the uvula to make the back of the throat as wide as you could. In addition to that, you do maybe a septoplasty and turbinectomy. But because I was doing things in my office and I don't do tonsils anymore. I see people who have these long, thick uvulas in addition to having the deviated septum and the large turbinates. And so in my office, I'm doing the surgery and I'm fixing those things. And oftentimes, people who had been on CPAP for 20 years would say, "Man, Dr. Smith, I haven't used my CPAP. I don't need it. I'm sleeping better. I wake up with energy. I'm not snoring. I'm not holding my breath." And we get a follow up sleep study on them just to make sure that they're okay, and they are. But it plays a critical role with sleep apnea. I mean, these people are going to sleep and holding their breath for 10 seconds or more several times a night. I have some people that sleep upright. And I think it's an injustice to put a mask on someone to force air through it without knowing if the nose is normal. Let's just think about that. Would you put a water hose on your faucet and turn on the water full blast if you didn't know if the water hose was open? No, you wouldn't. So it's very, very important to me. Again, I have to stress this, to look at the root cause and the anatomy first and make sure that's optimized before we put on a mask. You might not even need a CPAP mask, but even if you did, the pressure could be less. It would be more comfortable. You're going to be more compliant, which means you're going to sleep better. Then you're going to feel better, and so on.
yeah. I can't help. I've got like patients that keep popping up. I'm thinking of this. Like I've got a guy who's young, healthy, like mid 30s, healthy, has had lots of sleep issues.
Yes.
Um, uses a CPAP at that age, and this is somebody who's got like 7% body fat. Like this is not somebody who's in bad shape. Now is
There you
having
go.
lots of gut issues.
Mm,
You know, is that a downstream effect of that? I would love to hear your
yes,
thoughts on that. But, you know, has gone
absolutely.
through a crazy last 6 months of trying to figure stuff out. And I would be willing to bet that no one's looked at this.
I'd be willing to bet too. What you described to me is somebody who doesn't have the body habitus of someone who should have sleep apnea, which
Correct.
tells me
100%.
immediately, it tells me immediately, get a sinus CT scan, send it to me. I take a look at it. He seems like he works out a lot, which means he's probably active, which means he might have been an athlete early on, which means he might have hit his
Yeah.
nose, which means, all this is going
Yeah.
through my head. And
Yeah. All check marks,
he
by the way.
yeah, there we go. So he likely has nasal airway impairment due to a deviated septum and or turbinate hypertrophy or both. He likely has, if he's been snoring for a while, he is stretched. That negative pressure of just snoring will stretch your uvula to the point where it impairs your throat. And I would venture to guess that doing the procedures would help him tremendously. I can tell you, I just had a kid it sounds like you're describing a patient I just saw this week. He's about 35 years old. He wasn't sleeping at all. He was fatigued every day. He was up to 285 pounds. He couldn't exercise or anything. And he comes in this week and he goes, Doc, when I had my procedure, I was 285. He said, now I'm 258 and I sleep so well, Dr. Smith. I mean, I'm working out now. I have more energy. He's just exuberant about how he feels. He's like, Dr. Smith, you don't know. You changed my life. He said, you changed my life. He said, I didn't have any energy before, and now I have all the energy I want. I don't wake up tired. I'm performing better at work. And so just to hear him say this just brings total joy to me, because that's how young people should feel. That's how everybody should feel, you know?
Yeah.
So let's get a scan on him, send it to me or send it to me, and we'll scan him, and we can have him on the show next, and you can use him as your testimonial to talk about how he's changed.
What, you brought up like kind of lifestyle factors. Do you ask your patients to do sleep tracking like at home? I know, of course, we do a sleep study, but are there any technologies that you like to see if somebody's bringing that stuff in? Is there any for people who are snoring? Is there anything that people can do at home that helps them to track that in some sort?
Of course, the easiest thing is to use that iPhone and have your spouse or girlfriend, or the opposite, your boyfriend or husband, to record it. Just record it. Bring it in. Let's hear what you sound like. See how many times you hold your breath. But then you can also get a sleep study is also good. And they have good home sleep studies now that people can do at home rather than going to a facility for 2 nights. You can do these home sleep studies that really give you a lot of great information. But just if you don't have access to that, just getting the history and having that come from either the patient or their spouse or boyfriend or girlfriend is a wealth of information that you can use, because they will tell you, oh my God, we can't stay in the same room together, or I'm sleeping on the couch, or I can't get sleep. And that's a good start right there. But yeah, the home sleep studies are very good. And the videotaping and recording by the significant other is also very good information to use.
We've used Snore Lab. Have you heard of that? It's an app
No,
on your phone that
okay.
will monitor like the of course the incidence, but also the
Yes.
intensity of snoring, and it'll give them like a little. If I remember correctly, it'll give them like a grade every time, and so as people are going through that, they can just let it run, and it'll
Yes.
actually just be kind of monitoring as they sleep. It's
Oh, great.
simple app. I think
I
there's some
will use that.
minor in-app purchases, but if
Thank
anybody's
you.
listening to this and you want your spouse to have to check their own homework, Snore Lab might be a good one. We don't have any association with them, and I'm sure there's a bunch of
Uh-huh.
other apps out there that do it
Yeah,
now, but
yeah.
one of the ones that we had jumped on. Are there any other areas that people overlook that this relates to very highly? Of course, we've talked about migraines and other things, and I know it affects all areas of health, but are there any other kind of significant things that you see, people aren't getting this checked enough, in this type of diagnosis or these problems.
Yeah, I mentioned it earlier. I think those nagging things that people can have intermittently, the ringing in the ears, the dizziness, the muffled hearing, or hearing, feeling like there's water in their ears, those are very nagging. And I think a lot of times we might see patients getting labeled with Meniere's disease or things like that and getting these expensive tests. But it's very important to have the root cause examined, because a nasal airway obstruction can certainly contribute to those. We mentioned the headaches and the migraines, and these are headaches and migraines of all type. This is not, again, I want to stress, it's not just a sinus migraine. I've had patients with these hemiplegic migraines that resemble a stroke. I think this is something that I really want people, because it hit me again. These ideas come to me, and I called one of my colleagues. Actually, he was a professor of mine in medical school. He does neurology, and he implemented the mobile stroke units that we have here in Houston. And so it hit me, and I said, you have these migraine patients who have hemiplegic migraines that resemble a stroke. They go into the ER, they get worked up, and they're worked up like they have a stroke. And by about the second or third time, the patient's like, no, it's not a stroke, it's a hemiplegic migraine. So they're educating the doctors and the nurses. But it hit me that some people out there have been told they've had a mini stroke or a TIA. And while that can happen, where you get a carotid embolism that flicks off and it goes up into the brain and stops blood flow, oftentimes I'll ask those patients, what was seen on your brain scan? And I need to hear one or two things. It was a clot or it was a bleed. If I hear a pause or, well, they didn't, I think it's imperative for those people, instead of living with this diagnosis of having a mini stroke or a TIA, let's get a sinus CT scan and make sure you didn't have a hemiplegic migraine that resembles a stroke. To me, it just makes sense. It's like, before I go through life with that label, let me see if it's a migraine that Dr. Smith can take care of. Because that's two totally different things. So that's one area that I think needs to be looked at. Those hemiplegic migraines really throw a wrench into it, because these people, they get tremors, seizures, stuttering I've seen, paralysis, blindness, slurred speech, brain fog, GI problems. I had a patient once who told me after one of our telemedicine visits that, my headaches are gone, Dr. Smith. And to be honest with you, I've been constipated since I was 19 years old, and that's gone too. I have a young lady from Louisiana, 17 years old, with irritable bowel. She said she could never eat pasta or pizza. She was very rail thin, but her stomach, she said, was always bloated. And at our last telemedicine visit, she goes, oh, Dr. Smith, by the way, my migraines are gone, but Dr. Smith, I can eat whatever I want. So these are other areas that I've got to look into. And I think what it boils down to, migraines being related to all these neurological disorders, comes down to the body being controlled by nerves. And when you have an irritative focus in your nose, it will throw off nerves and neural impulses other places and give you these other symptoms. Because when your constipation gets better from a nose job, we have to look at that. When your irritable bowel gets better, we have to look at that.
I have a before and after MRI of a patient who had nasal surgery, and with no treatment to the neck or the disc, all of the accessory breathing issues were causing so much compression across the cervical spine that he lost cervical curvature and was getting multiple areas of disc bulging. After that, and all of that freedom to breathe correctly, reduce the stress on the head and neck and all the accessory muscles, the post MRI shows a normal cervical spine. And this is separated by not long. This is separated by 3 months or something. There's no treatment in there that would have changed that. So you look at these things and you're like, this is the foundation of us staying healthy, of being able to, get oxygen in safely, effectively, supply all of the brain, the nervous system. And if we can't do that, I think what we've talked about on here, hopefully people have gotten, this infiltrates every area of your health in your life. So
It
um,
does.
love it.
I get patients who have these headaches, and a lot of times they'll talk about their neck, the back of their neck really hurts. And there is a branch of the trigeminal nerve. The trigeminal nerve is the main sensory nerve to the face and sinuses and nose and teeth and all. And there's one branch that goes posteriorly, as I talk to my neurology colleagues. But I think a lot of it has to do with the fact that when you get a headache or a migraine, you tense up. You tense those muscles. You're hurting. And so when I relieve that, then it relieves those muscles and then they relax and they don't have the pain. So I could see, I'd never thought about the spine and the herniated disc, but man, that makes
Yeah.
sense. That's really
Yeah.
incredible.
Doc, this is awesome. I did have to ask you because I got quite a few questions when we were asking our listeners. They were like, "Man,
Yeah.
this guy presented at the Super Bowl. Can you ask him? What was he talking about? Who needed to reach out to him after that?" So I hear you either made a round or did anything related to the NFL in some of these sense.
Yeah, the NFL. I'm working actively right now and submitting information to the NFL because NFL players, active players, have a higher incidence of headaches and migraines and sleep apnea than the general population. I think the number goes even higher for retired players when you look at sleep apnea as well. It's like 20 times higher than the general population. And again, when you analyze what they do, I mean, they're playing this contact sport. They're going to hit their nose at some point, even before they became a professional.
Yeah.
So I was there to talk about what I do and how I could help these active and retired players have a better quality of life. And then when you talk about the active players in any sport, uh, you're talking about improved performance. You're talking about a longer career, hopefully more lucrative career. And hopefully they make the maximum amount of money that they can because they're performing better when they breathe better, sleep better, and their quality of life overall is improved. So I was talking about that, and it was interesting. This is my second year going to Radio Row, and one of Emmett Smith's handlers came up to me and said, "Oh, Doc, let me have your card." He said, "Emmett recognized you and remembered you from last year, and he needs you to take care of somebody he knew or something." And I hope he was talking about Troy Aikman because he has migraines too, and he needs to get those fixed. Yeah, but yeah. So I've started to get known there and had some wonderful interviews regarding just what we talked about today: sleep apnea, breathing, migraines, headaches, and letting people know that you do not have to live like that. There is hope to eliminate all those things and live a full, high quality life without pain, with lots of energy, so that all those other things we talked about today can improve. So yeah, it was fun. It was fun. I met a lot of people there, a lot of former players. I mean, my goodness, Howie Long, Adrian Peterson, who looks like he can still play, um, Emmett Smith, CJ Stroud, the new quarterback here at the Texans. I met him 2 years in a row there, and he remembered me from last year. So yeah, so it's good. And the more I'm out there, the more people are going to realize, oh yeah, there's this doctor. I remember him, and the word will get out, and people start understanding the message that I'm delivering.
We might need to get some of the Astros pitchers over to you. They've had a rough start to the
I know.
season. We need to do a
I
little
know.
step up. It's all right. It's a long
Yeah,
season.
yeah.
We'll be all right.
We'll get them. We'll get them.
Doc, we ask all of our guests if somebody's listening to this and they could do one thing today to improve their health. What would that one thing be?
Wow, one thing. Well, I'm going to be partial and say, things come to mind, but you want one thing.
We'll let you slide. We'll take two.
Okay, you take two? Okay. I think it's very important that you do realize that you are what you eat, and if you can eat a healthy diet, and what I tell my patients is, one, watch this movie. Those who have to lose weight, watch this movie, What the Health, on Netflix. I don't beat people over their brow, trying to say, oh, you need to lose weight, da 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 da. I just tell them to watch What the Health on Netflix. Watch it twice and let that sink in. The other thing is the Mediterranean diet has been listed as the #1 diet for the last 7 years. And I would say eat more Mediterranean food, go to a Mediterranean restaurant, and then see what it is about Mediterranean food that you could cook at home. It's that simple. Eat more of that. Now, you're in Louisiana. I always tease my Louisiana patients and say, look, don't you come to my office without bringing me some boudin or some crackling. I'm joking in a sense because I don't eat a lot of that. I don't, but I'll taste it. But yeah, it's about eating healthier. And then regarding, I think, understanding that getting a CT scan of your sinuses, regardless if you suffer or not, because I really do believe that at some point down the road, we're going to be scanning people routinely because injuries can happen at any point in your life. Getting a CT scan of the sinus, and for right now, you have to send it to me so I can look at it to review to see if you have any abnormalities there that might be causing you these unusual problems or these headaches, migraines, or other things that we talked about today, because those can be very, very impactful on your life. And I think if you could get a scan, send it to me, those would be the two things: what you eat and getting a sinus scan to send to me.
I love it. Doc, where can people find y'all? I know y'all have a pretty good presence online. Where can people find more
We
about
do.
your office?
Certainly. Thank you. My website is kevinsmithmd.com. That's pretty easy. The Facebook page is Smith Center Otolaryngology, which has we have dozens and dozens of video testimonials. I just take my phone out to patients who come in and have these awesome stories about how devastated they were before and how they feel afterwards. So the Facebook page has lots of videos about that. And then Instagram is @SmithCenter. And then the phone number is 713-795-0600. We get patients from all over the country. We get international patients from Canada, Mexico. Steve Harvey sent his business partner from Dubai because he remembered me being on his show about 15 years ago. And all they have to do is give me access to a scan either through a portal or ship it to me. I'll look at it, give them a call personally, and get them on their way to feeling better.
Love it, Doc. Much appreciated. Thank you for doing what you do and sharing this information. It's always the things that I think people are missing that can be affecting health in a lot of ways. So thanks for taking the time and doing this stuff. I know as a practitioner that sometimes these things are a little bit difficult to work into the schedule. So I really appreciate you kind of sharing this information and doing everything you do.
Thank you so very much. And I want to congratulate you. This is a very, very good podcast. I've listened to some episodes. You're doing some really great work out there. I love the name of it, the Pain and Performance Podcast. It addresses a lot of issues that a lot of people are suffering from. So you too have to be commended about what you're doing to help spread the word and to have me on so that I can talk to more people and enlighten people and help people have a better quality of life. So thank you as well.
All right, Doc, much appreciated. Thank you, everybody. Go check Dr. Kevin Smith out. And if you're my patient and you're listening to this, you'll probably hear more about this from me in the office. So, thanks a lot, Doc.
Thank you so much. Have a great weekend.